Hey guys, how's it going? I've been procrastinating this video for some time now, but this is my video on what it's been like recovering from metoidioplasty. Right now, I think I'm about 2.5 months post-op, feeling more than amazing. I've been feeling amazing for the last month or more. Definitely for sure since the beginning of October, and it's mid-October now. I believe it's specifically the, I don't know, the 19th, I think. But anyways, so, no, I'm sorry, I don't think it's the 19th. Sorry, that was bothering me. I think it's like the 16th. Anyways, so before I get into this really quick, I do want to give a fair warning. I will get into some female and male anatomy during the process of this video, and then I will be using some medical terms as well as talking about some like pain and blood and stuff like that. So if you're squeamish or if you're sensitive to any content using female or male terminology, anatomy wise, I'm going to be using that for most of this video, so just giving you a fair warning. You might not want to watch this if you're sensitive to that, but it's your choice. Okay, so really quick, I want to go over what they did with the surgery. So metoidioplasty it's a process of bottom surgery for trans male individuals. It's one of the types that you can have performed, and I had the metoidioplasty going into a phalloplasty. I didn't want to do just a metoidioplasty because I will get into this a little bit more later on in the video, but a metoidioplasty to me isn't satisfying enough. So with my surgery, they did what's called a full vaginectomy, which is a full removal of the existing vagina. So I had a partial vaginectomy when I had my hysterectomy performed about a year ago, in the summer of 2019. So when I had that performed, they did the partial vaginectomy then because it was easier at that time. How they perform the hysterectomy, they remove everything through the vagina, and then once they were done, they just removed the top, the cervix, I'm sorry, and the top maybe like 2 inches, so it wasn't as deep afterwards, basically. So I got a full hysterectomy performed. So that was I don't know if a full hysterectomy was required, but definitely a hysterectomy was required before going into the bottom surgery. So I had to have that performed way before they could even touch me for the bottom surgery. So I thought that would be important. You might want to definitely speak to your surgeon and figure that out before getting into anything. Figure out if you need to have a hysterectomy performed beforehand, or if they perform it in the OR while you're under the anesthetic, while they're doing their part, basically. So after they did the full vaginectomy, they basically like stitched up, if you will, the existing tissue together, and took a skin graft from the inside of my mouth, which is completely healed now. It's been completely healed. The mouth heals much faster than everywhere else in your body. So they took a skin graft to just create a little extra skin in that area to create a urethral lengthening in that area as well. So there wasn't basically enough existing skin, and there never is with anybody, and that's why they use the graft. So they use the graft because it's the same tissue that would have been used, or but that's already existing in your urethra, so it already has that smooth texture, and it would heal well, and it already works well. So instead of trying to use urethra tissue that was never there, they have something that's very similar or almost exactly the same that they can just take from a different area and use in the below area. So I am able to stand to pee now because of that, but I have to pull down my pants and I still have to use a stall. So there's really not a whole lot that's changed because of that. And that's kind of one of the things, like I said, that I'm going to get into a little bit later in the video. Okay, so recovery. Recovery wasn't that bad, honestly. I mentioned in the video where I was in the hospital that most of the pain that I was experiencing was in my rectum, due to the fact that the full vaginectomy was so close to my rectum, and they apparently use this guard that they insert in your rectum so they don't damage anything beyond the lining of the vagina or the existing vagina. They don't want to damage your tush. So I was in the hospital for 3 days, including the day that I was in there for the actual surgery. I was discharged on the 3rd day, I think. So by the time I got out, it wasn't that bad, but there was the catheter that I was dealing with, and that's something that I'm going to get into in a second. Or maybe I'll just get into it now. So I got discharged, and I was still dealing with a little bit of the pain in my butt. And I had the catheter, which was no fun. That was that was definitely not fun. So dealing with a catheter, the best way to deal with a catheter is to drink a lot of water, and they'll tell you that, but it's really true. You need to drink like twice the amount of water. You need to drink, I don't know, for sure. I'm serious, you need to drink like a gallon of water a day. You need to stay extremely hydrated. You need to keep your urine at like a light yellow to almost clear pretty much the entire time. There was some times towards the beginning before, like, I didn't really know any better because they didn't really tell me. So I kind of had to like figure it out myself, but they didn't tell me in depth, basically, how much I needed to drink the water. So there were some times in the beginning where my urine was coming out because I had the urine bag, so I was able to look at it, at my urine. So there was times in the beginning where it was like a pretty deep golden color, like almost like an orange. Like I was getting pretty concerned that there was like blood in my urine, but I knew that there wasn't really a thing because I wasn't seeing like any like actual blood coming through in the catheter line. So I wasn't really that concerned. It was just really dehydrated urine, honestly. So definitely drink a lot of water. Stay extremely hydrated. That's one of the best ways to deal with a catheter. It also deals very well with the comfort at that point with staying hydrated. You're still going to be in discomfort, definitely, for sure. I was definitely in discomfort 100% of the time. But it was more tolerable when I was well hydrated. So I had that. So another thing with how to deal with the catheter better was positioning. The bag, I was gonna like look around because I don't know. Well, actually, kind of. I was on this bed for the longest time, for pretty much the entire time I was back home for a week and a half to 2 weeks. I was pretty much on this bed because I couldn't sit upright because the catheter position wouldn't work that way. And it just caused more discomfort. And then on top of that, the new grafting basically, and then the catheter like affecting that area and causing friction in that area. There was some light bleeding from the catheter site. So where the catheter was being inserted for the new urethra, that's where there was blood discharge in that area. So there wasn't exactly a whole lot, but there was definitely enough to go through a few like 3 to 4 inch gauze pads a day. But I would cut them in half. They were 4-ply. I would cut them in half so they would just be a 2-ply, and I would go through maybe like 3 or 4 a day, and then just like go through like 1 throughout the night or something. But that was from the catheter rubbing and stuff, and just affecting the new area, and just not allowing it to properly heal. I mean, it was definitely still healing, definitely, because they couldn't have removed the catheter if it wasn't healing. But it wasn't able to heal on the inside as well, like putting on the new skin, I guess. I think it had to like put on a new layer of skin, and it couldn't do that properly with the catheter being there. I'm not exactly sure. That's just my theory. So I'm sorry, I meant to talk about positioning really quick with the catheter. And really quick, that was just super quick. You want to keep the bag underneath you at all times. You want to allow gravity to do the work. So all the time you want the gravity to be under your pelvis, or underneath your pelvis, below your pelvis, like however you want to do it. If you're standing, it has to be on the ground. If you're laying down, it has to be below your butt, like on the side of you, like down below. It just has to be below you to allow gravity to flow the urine through there.